Okay, now we will talk about this new regulation. One of the important points, that is the prescriptions and the veterinarians. Okay, so all vets must communicate monthly to the authorities all prescribed antibiotics in electronic way. From the authorities, we have control of the percentage of Group B antibiotics prescribed by the veterinarians, and the control of the amount of antibiotic prescribed by the veterinarian. So not only the Group B, but the Group B, as are the critical, are more controlled, and also the control of the amount of antibiotics used in each farm. It means that the authorities are making an average of use of antibiotics for each farm. Then if the use of antibiotics of your farm is over the average, they ask you why you are using more antibiotics than the rest, and you have to justify, and a part of justify, you have to make a plan to follow and reduce this quantity of antibiotic. Okay? And justification for the use of B antibiotics, Group B antibiotics. So the justification is that you have a therapeutic failure using antibiotics in the same flock or previous flocks. So you treat with antibiotics of Group C or D that are less restricted, but the results were not good in the same flock or previous flocks of animals. Then also you must report to pharmacovigilance as lack of efficiency. So you treat with other antibiotics, don't work for this indication, and you have to use a Group B antibiotic, the restricted group. So also you have to inform to the pharmacovigilance authorities that there is a lack of efficacy of this treatment with Group C and or D antibiotic. And the antibiograms. So for make a treatment with Group B, you always need antibiogram. The antibiograms are valid for 4 months, valid between post-weaning or fattening flocks from the same breeder farm, and valid for the same geographical area. Okay? And just some considerations that are also important in this new regulation, that are the following. Antibiotics shall not be used to compensate the poor cure hygiene, inadequate animal husbandry or lack of care, or to compensate the poor farm management. The consumption of antibiotics is monitored through data obtained from the electronic prescriptions, and the farms exceeding the established average are required to develop and implement a corrective action plan. Okay, then what means this? It means that as we have the data obtained from the electronic prescription systems, the authorities are controlling the use of antibiotics in each farm. Then they have an average, and you cannot exceed this average of use of antibiotics in your farm. And if you exceed, then you are required to develop and implement a corrective action plan in your farm. And the authorities will follow up this plan. Also, there's a limitation to only 1 antibiotic in a feed premise, and always after the clinical diagnosis. So you can use only 1 antibiotic in your feed premix. So in the past you can use one or more than one, and now you have to use only one, and after a clinical diagnosis, and the quantity will be limited for the treatment. Okay, if it is 5 days, you have to manufacture the feed for 5 days with this antibiotic, not more. For these reasons, for all these reasons, farmers and veterinarians are forced to improve the farm management in general. Okay, and now we will move to the data that we are collecting all the Europe to see the evolution of these antibiotics. This data is monitored by the AMA. So here we'll start analyzing the numbers. In the last 10 years, from 2011 to 2021, there was a decrease of 47% of the sales of antibiotics. So the sales of antibiotics decreased almost 50% and 60% in some countries in only 10 years. Then, for example, in the case of the polymyxins, the colistin, mainly, the decrease was 80%. So in the last 10 years, we decreased the use of colistin 80% in Europe. And in the case of the third and fourth generation cephalosporin was almost 40%. Because it's considered critical, these antibiotics, for the human medicine. Because are used for treat serious infections in people caused by bacteria resistant to most of the treatments. Here you can see a map of the European Union, and you can see the countries that are using more antibiotic or less. In orange, in dark orange, the ones that are using more antibiotics. Sometimes is related, or most of the time is related with the pig production, because the pig production is the most intensive in the use of antibiotics. So in a country like Spain, the use of antibiotic is high because we are the first producer of pigs, the first producer of pigs in Europe. So same in Poland, same in Italy, Hungary, they are producers of pig. So for the reason they look like they are using more antibiotics. Countries like France, that are more focused in dairy cows, so they are using less. Or the Nordic countries, also because the effect of the temperature. So here is very cold regions, so the south is more warm, so the bacterial growing is easier and faster.